Think you know all about psychopharmacological drugs? Well, think again. Welcome to a journey where we'll be exploring the complex and fascinating world of psychopharmacological drugs. But first, let's take a moment to clear the air of some common misconceptions that often muddy our understanding of these powerful substances. The first myth we encounter is the belief that psychopharmacological drugs are exclusively used for serious mental disorders. While it's true that these medications play a pivotal role in managing conditions like schizophrenia, bipolar disorder, and severe depression, their use extends far beyond that. They're also employed in treating a broad range of issues including insomnia, anxiety disorders, ADHD, and even chronic pain. So it's not just the serious conditions that benefit from these drugs. Another misconception is the idea that these drugs cure mental illnesses. This is a bit of an oversimplification. Yes, they can significantly improve symptoms and quality of life, but they are often part of a comprehensive treatment plan that may include psychotherapy, lifestyle changes, and other interventions. These drugs aren't magic pills. They don't erase the problem, but they do help manage it, making it easier for individuals to navigate their daily lives. Let's also bust the myth that taking these drugs means you're weak or crazy. Mental health issues are medical conditions, just like diabetes or asthma. And there's nothing weak about seeking help. In fact, it takes strength to acknowledge when you're struggling and to take steps towards getting better. Finally, it's time to discard the notion that all psychopharmacological drugs are addictive. While certain classes, like sedatives and hypnotics, can lead to dependence if not properly managed, many others, such as antidepressants and antipsychotics, don't carry the same risk. Dependence is not a given. It's something that can be managed with careful monitoring and the right medical guidance. Now that we've busted these myths, let's dive deeper into the world of psychopharmacological drugs. Ever wondered how antipsychotic drugs work? Here's the scoop. Antipsychotic drugs, as their name suggests, are used to treat psychosis, a severe mental disorder characterized by a disconnection from reality. This disconnection can manifest as hallucinations, delusions, or disorganized thinking and behavior. Common symptoms in conditions such as schizophrenia, bipolar disorder, and severe depression. So, how do these drugs work? The human brain is a complex organ, bustling with activity. It communicates via neurotransmitters, chemical messengers that transmit signals across synapses. In the case of psychosis, the brain's messaging system gets a bit jumbled. There's an overactivity of a neurotransmitter called dopamine, which is where antipsychotic drugs come into play. Antipsychotic drugs work by blocking certain dopamine receptors in the brain, specifically D2 receptors. This helps to regulate the overactive dopamine system and bring the brain's chemistry back into balance, reducing the intensity of psychotic symptoms. Now there are two types of antipsychotic drugs. First-generation antipsychotics, also known as typical antipsychotics, and second-generation or atypical antipsychotics. The main difference between these two is that the second-generation drugs block not only dopamine receptors, but also certain serotonin receptors, another key neurotransmitter in the brain. This dual action can help manage a broader spectrum of symptoms and is often associated with fewer side effects. Speaking of side effects, it's important to note that, like any medication, antipsychotics can have them. These can range from dry mouth and constipation to more severe ones like weight gain, drowsiness, and movement disorders. It's crucial to discuss these potential side effects with your healthcare provider and to use these medications responsibly. Antipsychotic drugs are powerful tools in managing certain mental disorders, but they're just one piece of the puzzle. They work best as part of a comprehensive treatment plan that may include therapy, lifestyle changes, and other interventions. Remember, mental health is a journey, and it's okay to seek help along the way. Feeling anxious? Let's talk about anti-anxiety and sedative-hypnotics. These two categories of drugs are often used interchangeably, but they have distinct roles in managing mental health. Anti-anxiety medications, also known as anxiolytics, function by slowing down the central nervous system. This induces a calming effect, reducing feelings of fear, tension, and anxiety. Among the most commonly prescribed are benzodiazepines, which include drugs like Xanax and Ativan. These drugs are often used for short-term relief from acute symptoms of anxiety. They can also be prescribed for panic disorders, post-traumatic stress disorder, and even as a pre-medication before certain medical procedures. Sedative-hypnotics, on the other hand, are primarily used to induce sleep and reduce agitation or anxiety. They're often prescribed for insomnia and are particularly useful in helping individuals fall asleep, stay asleep, or both. Examples include Ambien and Lunesta, which are non-benzodiazepines, often referred to as Z-drugs. It's important to understand, though, that both anti-anxiety medications and sedative-hypnotics have the potential for dependency and misuse. They can be habit-forming, and long-term use can lead to tolerance, where larger doses are needed to achieve the same effect. Withdrawal can occur if the medication is abruptly stopped, and this can lead to symptoms that are often more severe than the original problem. Furthermore, these drugs are not a cure for anxiety or insomnia. They can provide immediate relief from the symptoms, but they don't address the root causes. Cognitive behavioral therapy, mindfulness, and lifestyle changes are often recommended to tackle these underlying issues. So while anti-anxiety and sedative hypnotics can provide a temporary solution, they should be used with caution and ideally under the guidance of a healthcare professional. Remember, these drugs are tools, not solutions. It's important to use them correctly and responsibly. While these drugs can provide immediate relief, they don't address the underlying causes of anxiety and insomnia. Scene script. Depression and bipolar disorder are complex. Let's understand how antidepressant and antimanic drugs help. In the vast universe of psychopharmacology, antidepressants and antimanic drugs act as the guiding stars for those grappling with the tumultuous waves of depression and bipolar disorder. They don't cure these conditions, but they do play a significant role in managing their symptoms. Let's start with antidepressants. Often, depression is linked to an imbalance of certain chemicals in the brain, known as neurotransmitters. Antidepressants work by restoring this balance, particularly focusing on serotonin, norepinephrine, and dopamine. These neurotransmitters are like the brain's communication lines, passing messages between nerve cells. There are several types of antidepressants. Selective serotonin reuptake inhibitors, or SSRIs, are often the first line of treatment. They increase the level of serotonin in the brain by limiting its reabsorption into the nerve cells. Other types include serotonin and norepinephrine reuptake inhibitors, norepinephrine and dopamine reuptake inhibitors, and tricyclic antidepressants, each working a bit differently to achieve the same goal. Like every other medication, antidepressants can cause side effects. These might include nausea, weight gain, insomnia, or fatigue. However, these side effects often subside over time. Now, let's shift gears to antimanic drugs, or mood stabilizers. These are primarily used to treat bipolar disorder, a condition characterized by intense mood swings. Mood stabilizers work by decreasing abnormal activity in the brain, helping to maintain a more balanced emotional state. Lithium is one of the oldest and most commonly used mood stabilizers. Other options include anticonvulsant medications, which were originally developed to treat seizures, but were found to have mood-stabilizing effects as well. Side effects of antimanic drugs can range from mild to severe and may include tremors, increased thirst, weight gain, and cognitive difficulties. It's important to note that everyone's experience with these medications is different. These drugs can help manage symptoms, but they work best in conjunction with other forms of treatment. As always, it's crucial to have open, honest conversations with your healthcare provider about your treatment options and any potential side effects. Psychopharmacological drugs are not magic bullets, but they can be essential tools in managing mental health. As we've journeyed through this vast and intricate landscape of medications, we've seen the role each type of drug plays and the importance of their responsible use. We started off by dispelling myths that often surround these drugs. They're not just happy pills or shortcuts to a carefree life. They're carefully crafted substances designed to help manage and treat mental health disorders, always best used under the guidance of a healthcare professional. Then we delved into antipsychotic drugs, exploring their role in managing conditions like schizophrenia and bipolar disorder. These drugs, although powerful, are not cures but tools that can help manage symptoms and improve quality of life. We journeyed further into the realm of anti-anxiety drugs and sedative hypnotics. We learned how these medications can help soothe the tumultuous seas of anxiety and promote sleep, yet how they also carry risks, such as dependency, highlighting the importance of their controlled use. Finally, we discussed antidepressant and antimanic drugs. These medications can be life-altering for those grappling with the dark clouds of depression or the roller coaster ride of mania. But again, they are not silver bullets. They are part of a comprehensive treatment plan that may also include therapy and lifestyle changes. This vast pharmacological world is complex, but understanding it can be empowering. The knowledge of these drugs, their uses, effects, and potential risks can help us make informed decisions about our mental health care and advocate for ourselves and others. Remember, knowledge is power. The more you understand about these drugs, the better equipped you'll be to use them wisely. Always consult with your healthcare provider and make sure you're making the best choices for your mental health. So keep learning, keep exploring, and stay curious. Subscribe for more because you won't find me later.